Walking through the aquarium is exciting for any 10-year-old, but for Kevin, walking anywhere is unbelievable.
Kevin was born with Moebius Syndrome, which means he's unable to smile, blink, grimace, or make any kind of facial expression. With Moebius Syndrome, they can also have club feet, and he has club feet.
Unfortunately, there is no cure for Moebius Syndrome. However, there are treatments for those who suffer from clubfoot. One such technique is called casting, where the patient's feet are placed in hard casts in an attempt to realign them.
We had his feet put in casts to slowly try to correct them. We did this multiple times over the years, and all of them failed. None of them worked.
You know, when Kevin was first born, I thought, I'll give him 5 years. He's going to be a normal little boy. Just fix his club feet and he will be fine. And then 7, 8, 9 years down the road, we've gone through all of these castings and all of the braces, and we just almost lost hope.
At one point a few years ago, we had a doctor recommend amputation, and that was not an option for us. That was crazy to us.
Resigned to the reality that Kevin would never walk and be wheelchair-bound, Kevin's parents shifted their thinking when Kevin's behavior changed.
Kevin was 7 when he started showing signs that he wanted to walk. He started pulling to stand, climbing onto furniture, asking for our hands to walk around. But his feet were so turned in and so deformed at that point, he did not have a good base to stand on.
Armed with Kevin's newfound determination, Kacie contacted Dr. Hatch, who had treated Kevin in the past, to see if anything could be done.
Unfortunately, Kevin had a type of clubfoot that's more resistant to conservative treatment. These cases are ideal for the use of external fixation and gradual correction.
Dr. Hatch explained how the TL-HEX external fixators are secured to the bones by using wires and half pins, and that by gradually adjusting the struts and the position of the rings in precise increments, Kevin's deformity could be corrected.
I had never seen fixators. Seeing them on the website was intimidating, and picturing them on my child was intimidating. And I was scared of the care, and I was scared of the surgery.
I think the biggest impact for parents to understand when they're contemplating something like this is the fear of the visual impact of looking at the frame.
When Kacie brought Kevin down to our house and he had the fixators on his legs, it was a bit of a shock, because it's not like a regular brace that we were used to in his casting and things.
When I first saw Kevin's feet in the fixators, I thought, what did I get myself into? Adjusting the fixators for the first time was very scary. I thought I was going to hurt him. I thought I was physically going to turn his little bones and crack them and hurt him. And that wasn't the case. We turned his fixators 3 times a day. And there were only a very, very, very few times he even knew I was turning them.
With a careful therapy regimen and Kevin's strong determination, a 10-year-old boy who had never walked in his life soon found himself up and about.
Having him come out of the fixators so motivated was just awesome for us, because we knew that we had done the right thing. Only 6 months of therapy, and we went from non-weight bearing to walking, just holding my hands.
When I saw Kevin at his 6-month exam, I was extremely pleased with his outcome. He is walking almost 100% independently, maybe hand-holding by his mom, but he's wearing shoes. He has some braces on his lower leg, but with his gait and independence, it helps his mom so he doesn't have to be lifted everywhere. He's enjoying a healthy lifestyle and being active with people that are similar age, and the bottom line is he's still got his legs.
When I got the video from Kacie of Kevin walking, it was a complete shock to me. I'm in the middle of my work day and I get a text from Kacie of Kevin walking, and it took me a minute to go, what am I looking at? And I'm watching Kevin walk for the first time in his life, you know, with minimal assistance, and it was a tearjerker. It was definitely the outcome we were looking for, and it really was pretty neat to see.
We love going to the aquarium. It's one of Kevin's special places he likes to go, and going there with him and having him be able to be free from the wheelchair and just holding my hands and guiding me to where he wants to go and showing me what he wants to see is a great feeling and such a huge step in his independence. If I was going to talk to another parent about the Fixators, I would definitely tell them that it is a long road. It is not easy, but it is so worth it.
Caution. Federal law, USA, restricts this device to sale by or on the order of a physician. Not everyone responds to extremity fixation devices in the same way, and patient experiences may vary. To understand the benefits and risks, please discuss them with your doctor. A prescription is required. For complete safety information, please visit Orthofix's website at www.orthofix.com and click on the Instructions for Use tab located in the product section of the website. The TL-HEX system is intended for limb lengthening by metaphyseal or epiphyseal distractions, fixation of open and closed fractures, treatment of non-union or pseudoarthrosis of long bones, and correction of bony or soft tissue defects or deformities. Indications for adults in all pediatric subgroups except newborns include post-traumatic joint contracture which has resulted in loss of range of motion, fractures and disease that generally may result in joint contractures or loss of range of motion and fractures requiring distraction, open and closed fracture fixation, pseudoarthrosis of long bones, limb lengthening by epiphyseal or metaphyseal distraction, correction of bony or soft tissue deformities, correction of bony or soft tissue defects, joint arthrodesis, infected fractures, or non-unions. The TL-HEX system is not designed or sold for any use except as indicated. Use of the system is contraindicated in the following situation: patients with mental or physiological conditions who are unwilling or incapable of following postoperative care instructions. For more information, please refer to the relevant product IFU, operative technique, and software support material. This video contains information about an extremity fixation device that is cleared for use in the United States, and this video is intended to be viewed by residents of the United States. This video is intended to be viewed in context of youtube.com, vimeo.com, or an Orthofix website. Orthofix is not responsible for the context in which it is shared.